Hi, I'm Coach CJ. Welcome back to True North. This is a great place for you to train with me every week. And of course, our goal is the same all the time. It's to help increase your new patients, your conversions, your retention, and to definitely increase your influence on chiropractic in your community. And we do that by tackling tough questions. And again, I appreciate so many of you for bringing in your questions to me, Coach CJ at fplforlife.com. And over the next month, you're going to be mind blown with the videos that we have and the practical answers to some very difficult situations that are going on in practice today. So Donna writes in, Coach, what's the best way to handle new patients who are resistant to provide history of trauma on day one? I know how important this is to the success of my conversions. Thanks so much. Well, you see, what we may not realize is this. There's three things I want to get across to you today. All of my clinical research of some 25 years and over 15,000 teams says this. When a patient can recall and when they can proclaim 5 traumas on that first day, things like an auto accident, and they don't have to be 50-mile-an-hour accidents, that they actually got hit from the side, the back, and there was a 10-mile, 20-mile, 30-mile auto accident. It might have happened 8 years ago, 10 years ago. It may not have even been when they were driving. Maybe their parents were driving. The point is this, that there's always 2 or 3 automobile types of incidences that are going on in our patients. In fact, the driver of a motor vehicle reminds us that a patient is in, or a person is in an auto accident on average every 10 years. The average person's 32 years old coming into a chiropractic practice. So by the time we actually start looking at auto accidents and then what are potential work injuries, even repetitive injuries that are happening, sports injuries, hobbies that they like to play, and when was their most recent slip or fall, there or at home. And so really 5 traumas within 5 minutes should be your minimum expectation. But you know, sometimes patients get preoccupied. When you're asking them questions about their history of trauma, what might happen is a blank. You know, and so it feels to you and I like they're resistant, like they're not really answering the question, they're not contributing, they're not participating. Well, be careful. What this means is that somehow they're not drawing into their memory bank. And so there's a frightened, they're either frightened, worried, or they're preoccupied, distracted somehow. Some of it is they still just don't know what you're doing with chiropractic, and so they're wondering, we're asking questions in this direction, but what does this have to do with the pain in my side? You follow me? And so there's something else going on in their mind which is precluding them from being able to tell you what is absolutely critical right now. Do you know that people that are able to give you 5 traumas in the first day are people that are going to have over 70% conversion to your best recommendations in your follow-up report of findings. So this is non-negotiable. Make sure then that you circle back. My suggestion has always been this. Do your posture exam before you do your history of trauma. Why? Because when you stand somebody in front of a mirror and you have them close their eyes and the mirror is right in front of them, and you're in between them, and you're asking them to nod their head up and down a couple of times and stop where they think they're looking straight ahead, well, this is what's going to happen. And you tell them to open their eyes without moving their body, and when they open their eyes and see, oh my goodness, my head's shifted, it's rotated, it's forward, this shoulder's high, this hip is rotated, and you're able to see that from behind them, well, the average person has 8, 9, 10 postural imbalances. Do you know, if you do the posture check first, and how do you do that? Well, after you greet the person, you actually do what's called a pre-consultation, talking just over a minute or 2 about what subluxation is. Use a spine so it's very visual. They can talk about how this creates the unwanted conditions that people suffer from every day because it interferes, blocks the nerve system from functioning properly. And then you say, what I'd like to do now is to perform a few powerful tests to determine what course of exam to take with you today. Check their posture. I like to have them on bilateral weight scale, so we're doing both of those exams at the same time. And they look down, and sure enough, they're 8, 9, 10, 15, 20 pounds heavy on one side, and they see 6, 8, 9 postural imbalances. Do you know that when you sit down after that, you could do a standing or sitting palpation, by the way, while you're doing that? So it's very simple, very quick, and very efficient, very powerful way to do that. And you begin your history of trauma after that. Do you understand that every trauma, every injury, every episode that this person is now bringing up is identifying with the postural imbalances that we see, which are then going to absolutely, by the report of findings, correlate with the conditions, the dysfunctions that they walked in with. So if we're not actually seeing that we're getting past a resistance, the person's distracted. You've got to bring them back. Chances are you did not do the postural evaluation before you went into your consultation and the history of trauma. If that's the case, what do I suggest? Stop. Stop the consultation and say, you know what, let me perform one powerful test here before we continue on and go right into posture. And you will see exactly what I just said, 4, 6, 8, 10 postural imbalances, the bilateral weight scales. Then you're able to turn back and use a comment like this. Sandy, very rarely does someone hold the postural imbalances that you have, and with the spasms and the tension that I feel in your muscles, and of course the poor distribution that I see on both of these weight scales, without a number of impacts in their past that's led to these painful results. Let's dig a little deeper and discover what's caused these together. See, that's beautiful conflict resolution. It gives you a chance to connect with somebody who's maybe just tense, somebody that maybe didn't sleep well last night, somebody that's been distracted, and bring their present time consciousness right back to you. And suddenly, a person who wasn't able to think of any kind of past injury, guess what? In the next minute and a half, you've got 4 or 5 more that, oh gosh, yeah, that's right, I fell out of a tree right on my back. I remember even fracturing a rib, and that was about 4 years ago. Suddenly, the mind remembers, that's right, I had this and that. And what seemed to be a difficult situation in that consultation, in that day one, turned out to be now glorious. This patient's going to have a phenomenal conversion. They're going to have a phenomenal healing, and they're going to be telling all their friends because you knew how to get past that resistance. Well, I look forward to training with you again. Tell your friends about this. I'll see you next week. Until next time, and as always, practice with passion. Have a wonderful day. God bless.